Wow. That's what I think is the thing I take away first off. Wow, we're all here. Amazing. I've learned so much. I came with quite a few scribbled notes, and I've got a few more because it's changed as I've gone along throughout the day so far. So thank you to all those additional little bits of learning that I've got this morning from personal stories, expertise, and just the general knowledge that's here. And that really kind of brings me to my first kind of point that I want to raise with everybody. What's really struck me is HRT may not be the panacea for everyone, but certainly we've got to be talking about it. And that I was going to talk in more depth about what we're doing at Kent, but I've had the real privilege of having a number of conversations with Hayley and what she's doing in Cambridgeshire. And actually, I'll be repeating some of the same stuff. So what I'm going to do is talk about some of the key things that I think we could all do. So it doesn't matter which service you represent. It's about improving it for the sector. It's about getting better places to work. And it's about people having better experiences. So I'm going to start with a little story. Last week, I was going on holiday, and I had cause to get out both my birth certificate and my daughter's. And what really struck me was on my birth certificate, it said occupation, space, father. That's it. On Amy, my daughter's birth certificate, it said occupation, father, space, mother, space. I thought, in a generation, I'm actually recognised as being in the workplace. And there are a lot of women in the workplace. Roughly, if Mike can get this to work, roughly there's 5.87 million in the UK women in the workplace, and 1 in 4 of them are likely to be perimenopausal or menopausal. That's huge. Could I just ask you for a second, just look around the room at how many people we've got in the room. So that's 1 in 4, maybe higher in this room because we're a menopause-specific conference. But that is an awful lot of people, and it's an awful lot of people who are not able to talk about what's going on for them. So my top thing that I really want you to do is take away, and I know you're committed and I know you're passionate, but maybe have a bit of sort of word bingo. See how many times you can get the word menopause or, hot flush or, oh, my body aches, why? Ask people when they make comments in the room that you're in. Just talk to each other. It's quite fun, actually, when you do word bingo, because you'd be surprised how many times you can do it and in what situations you can put that word into the conversation. So I am going to ask you to go and do something from this conference, and I'm asking you to do it as often as you possibly can. There is, and we cannot get away from it, a societal view that means that we just don't talk about our bodies. We need to talk about our bodies. We need to be talking about the menopause in school in the same way that we need to be talking about it in the workplace. So we need to overcome that stigma that we've got, and we need to push harder, push further, make the environment much better for each other. It just sort of blows my mind, really, that something that is so entwined with our very existence as human beings is something that we just don't feel able to really talk very much about. And the place that, our workplaces are changing, and yet we're still not really gearing them for more women in the workplace. So, and I do genuinely believe that is related to that silencing that's going on. I think maybe sometimes as individuals we're a bit stoic. We don't. There is that kind of sense of vulnerability. But if we realise that it's 1 in 4 of us, then there's an awful lot of vulnerability, isn't there? And then if we take that vulnerability away because we're quite happy to talk about it, then actually we're no longer vulnerable, and that makes a much better place for everyone. There isn't a silver bullet. It's hard work. Any inclusion work is hard work. But we really do need to make that change. And how we talk about it is really, really important. What I would say is it's not okay to blame, shame, dismiss, disregard. That's all not okay. And I know none of you in this room would want to do that. It's also not okay to make it ageist. I have said myself, oh, it's just my age, ha, 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 ha. And I know now that that's just really not okay. We need to think about how we frame the language that when we're talking about menopause to that as it's been very clear this morning, it's a natural process. So let's talk much more positively about this as a process that is happening to an awful lot of people. If we don't create those opportunities, we leave people out and we leave them with only their own experience to guide them. And we are limiting the discussions, and as a result, we're limiting the creativity and we're limiting the solutions. So ultimately, we become less inclusive in our workplaces. We need to talk about some of the things that we can do that can help people that are really simple. Not all of it is complicated. Not all of it costs a lot of money. But not talking about it costs a lot of money. And I know Hayley mentioned just if we took just how much would it cost for one day to be accounted for all the women in the service. And I'm just going to jump to my, if I can, to my last slide. I did a little bit of work because the next thing I'm going to ask you to do is use data. So once we're all talking about it, start using your data. So there's roughly, looking at our national statistics, 8,207 women working in the fire sector. The average age, I heard the other day from government, was around about 30,000, not necessarily for our sector, but across the country. So I did some sort of rough calculations. And if 59% of people are taking sickness around, which again was some research that I got from Dr. Newson, then it's costing us £422,000 a year because we're not talking about the menopause and we're not putting things in place. That's a lot of money, and that's a lot of money for a sector that is going to be facing some real economic challenges. But just to go back, I probably should have put these in the other order. See, every day's a learning day. When I looked at some of the information, it was 59% of people said that they had taken time off, and that was only working on one day. But 18% were taking over 8 weeks. And furthermore from that, of 50% of that 18% were actually leaving our organisations. What a waste. What a waste of experience, skill and expertise. And there's some research from Legal and Accounts that says that it, from, again, on that average £30,000 wage, it costs you £12,000 to just re-recruit against that. So we're talking a phenomenal amount of money, aren't we? And we really can't waste that. So top tip, talk. Next tip, get the data. Use the data. Build it up as an argument in your own service. Talk to people when they're making decisions around that cost implication. It's the bottom line, and it does prick up ears. It does get people thinking. But there's all sorts of other data you can use, and not thinking it just in sort of numbers. Do surveys, speak to your forums, get your exit interviews, ensure that they're meaningful, build it into your processes. So there's loads of other bits that you can do around thinking about how you can use data. Whether that is numbers or anecdotal feedback around that. And the last thing that was sort of my top three, if you like, and I was really pleased again to see that Hayley's already doing it, is our sector is geared to risk assess. So why aren't we risk assessing menopause more broadly across everything that we do? You may have people impact assessments or equality impact assessments that you're using, and menopause may fall across age or disability or sex. But actually, why don't you have it just as an additional consideration, a non-legislative consideration, if you like, a standalone, that you just think about these things in terms of the menopause, your workforce. You build it into your other risk assessments around things that are doing. You build it into, has your policy considered menopause when you've put it together? So you can use it in lots of different ways, and you can use that risk assessment approach, which we're really good at. What's the likelihood and what's the severity? Just keep applying it across, build it into whatever job you might be doing. Now, I went away and pulled in different sort of pieces of information so that I might be able to give you something that I thought you could take away today. And a couple of things that really kind of grabbed me that were just so simple. We all work in lots of different buildings. Why don't you just go and look at where are the warm spots and where are the cool spots, and then perhaps put a hot desk in those areas? Then people can go and work. If you build it into your flexible working policy, they could go and work in an environment that might suit them. And if they're working in an environment that might suit them, bear in mind that working environments, it plays a major factor for people in their well-being, then you've already built in something that's really easy to do. It's a space you've got and it's cost you very little. Other things was giving people a notepad when they're going for an interview. Well, that not only helps people who are neurodiverse, but it certainly helps somebody who's got brain fog, just to make a couple of, and then you get them to perform at their very best and really see what they're capable of. Or perhaps you can have it that you already, now I've forgotten what it is, see my brain fog's now happening. I knew I'd written it, but I've got too many pages because there were too many notes. But you can put in lots of other things in there. So it's just about thinking about things differently. And if you really haven't got any one nugget from any of the speakers today, I would absolutely urge you to go and have a look at the relatively new British standard. So there is a standard that gives you a whole host of accommodations that you can consider. It outlines everything that is related to your menstrual health and well-being in the workplace, as well as menopause. It's all in one big document. It's a really easy read. It's not got big complicated words, and you can flick to just the accommodations page if you like. It's really well laid out. But it also gives you a benchmarking tool as part of it. So if you're really not sure where to start and you want to start to work with your organisations, you can go to that and that will help you. But also don't forget, we've got Jules from Women in the Fire Service here with us today. We've got Hayley and the Menopause Champion, and I know that the NFCC have already made their commitment earlier today to keep this on the agenda. So go away, talk to other people, look for people who may not be talking. You know, there'll be all sorts of things, all sorts of signs and things, of little flags that people are waving at you and saying, I just need to have that conversation because I'm in the dark. So if you do nothing else, please keep the conversation going. We need to change the way that we look at menopause in the workplace. Thank you.